So today we will see episiotomy wound healing by using infrared radiations. So in the infrared radiation, we are going to see introduction, how we are going to apply the infrared therapy in the episiotomy undergone mother. So the chapter is as follows. Introduction. Infrared rays are electromagnetic waves. It lies between visible light and microwaves. The wavelength which is used for in infrared light is 250 nanometer to 4 lakh nanometer. Infrared light therapy is usually used for the superficial heating only. Precautions of IR therapy are: the infrared exposure to the tissue should not be more than 30 minutes. The distance between the source of the lamp and the tissues should not be less than 18 inches. Ask the patient not to touch the infrared light lamp or the wires during the treatment. Ask the patient not to sleep and move towards IR lamp during therapy. So the person who is sensitive to the skin should be taken care. Next is setting up. Expose the skin that is to be treated, but we have to cover the eyes with the towel or goggles. Position the lamp at 90 degree so that the radiations will strike directly on the surface. Next, set the lamp at the appropriate distance, almost nearly 45 to 50 centimeter if we are using the smaller lamp, and if we are using the larger lamp, then we have to keep the lamp at least 60 to 75 centimeter away from the area. Next is how to apply the infrared light therapy. Position the patient in a suitable and well supported position, especially semi-recombinant or a lithotomy position, with the area that is to be treated is to be exposed. Then explain the nature and effect of the treatment to the patient. Then before starting the treatment, examine the skin to be treated and test the thermal sensation. Next is application or the procedure. The intensity of the heating is controlled by distance of the lamp from the area. The adjacent areas can be protected from heating by placing the layer of towel or center hole towel. The therapist should check the level of heating on completion of the setup and again after 5 to 8 minutes, and if required, adjust the distance of the lamp to the skin. IR usually applied for 10 to 15 minutes as it is only a part of a treatment. Post procedure, switch off the infrared light, then make the patient comfortably to sit or to sleep and give something to eat or drink. Let patient be in comfortable position and replace all the articles as usual. Here is a reader scale. The reader scale helps us to identify the episiotomy wound healing process. Here we are going to assess redness, edema, ecchymosis, discharge and approximation. Contraindications where we should not use IR therapy are: in case of dermatitis or eczema, any cutaneous circulation defects, hemorrhagic condition, any impaired thermal sensation over the areas, if the person is having scars over the area, or if he is severely edematous, and if the person is having any metal implants in the tissues. Advantages: it is very cost effective and can be easily used even at home also. It is very comfortable even in the winter and can be used in the large areas in order to treat the large areas, and also it helps to maintain the temperature of the skin.